afternoon, everyone. Thanks for posing this question to me. Being a cybersecurity specialist, what I understand is that, with the use of AI and digitalization in the health sector, obviously there is a lot of improvement in the efficiency that we see. At the same time, we also see that, it is bringing out a lot of good fruits in terms of informed decision by the health practitioners, and whereby ultimately the benefit goes to the patient in terms of treatment. There are high rate of success that we can expect. Because, these AI and data-based information will help you diagnose the problem in a much better manner. But the biggest challenge, as you have pointed out, is the integration. There is no formal standardization of data in the health sector that we've seen, at least in India. There is no stringent regulation like HIPAA, which is at least implemented in the Indian continent. We've seen it elsewhere, but not in India. And hence, from my perspective, what I see that these informations are stored in various hospitals, in various health sectors, like, we go to a pathological lab, we give our information there, we go to a hospital, there are a lot of information that is residing, but there's no proper integration which has happened. And that's where the biggest challenge that appears in front of all of us. It's a big challenge that how do we standardize it? The best way to standardize it, the answer to this is that we should have a classification platform in the system which is not manual driven. Since we are talking of AI, we should use AI in the manner as if it's a human brain, which is able to understand the content residing in the information. It should not be manual, that we are manually going to classify any health information or a patient data. It should not happen like that. The only solution that appears to me is automation, complete automation, no manual intervention, wherein use AI to read the content, understand it, that what sort of information it is, how it is correlated across the system, and there should be a standard format which can be adopted by all the organizations in the health sector. There should be a common forum which can come out with the data and information residing in their system, and with this common forum you can devise a system which can automatically classify all sort of structured or unstructured data residing in the health system. This is the only solution which comes to my mind as of now. However, it requires a lot of research and development in the field of health sector to avoid challenges of, I think, ethical issues and sanctity of the information which is being used by AI regarding a patient. Because, I do not know whether I have given my consent or not, but my very personal health-related information is being used by the health sector to get some information. It can be very personal, related to my disease, which I would not allow them to be used. So there are a lot of ethical and moral concerns related to it, which will remain as it is, and this will require some long time to mitigate these challenges.